It was a moment Sri Kumar didn't ever want to live to see.
He got up, putting his hand on his chest, and just crashed. That moment, he died.
Monday, his 44-year-old son Prashant Sri Kumar went to emergency at Grey Nuns Hospital with extreme chest pains.
He saw me, he got up, Papa, I cannot bear pain.
He waited for hours. The nurses did an ECG to check his heart and said there was nothing of significance. As time went by, nurses also did blood pressure checks.
Went up, and up. For me, it was above the roof.
After what the family says was more than 8 hours, Prashant was finally called into a triage area. But soon after, he suffered from an apparent cardiac arrest. Nurses called for help, but Prashant had died.
He was such a nice kid. He was all for the family, all for his kids.
He leaves behind his wife and 3 children. His loved ones want answers.
We need justice for him, and this is something we need to raise our voice on so that the next person who walks in can be protected.
And we expect better from our healthcare system and hospital.
Covenant Health said that they will not be commenting on the specifics of a patient's care because of privacy. But they did confirm that this case is now with the Office of the Chief Medical Examiner. They went on to say, quote, "We offer our sympathy to the patient's family and friends. There is nothing more important than the safety and care of our patients and staff."
I remember this one.
As family tried to remember Prashant for all the good he brought them, they say they'll always be haunted by how he died in pain in a hospital without ever seeing a doctor.
They took my baby for nothing. For nothing. You know. For nothing. I'm so sorry.
44-year-old father of 3 walked into an emergency room in Edmonton with chest pain. 8 hours later, he was dead. And the hard question to ask is this: could this happen to anyone? His name was Prashant Sri Kumar. He was an accountant, a husband, and a father. He went to Grey Nuns Community Hospital expecting help, because emergency rooms are meant for moments like that. But he was never seen by a doctor. Chest pain is not ambiguous. It's one of the clearest medical warning signs there is. Yet, amid overwhelming demand, Prashant waited nearly 8 hours and died of apparent cardiac arrest. After his death, his widow released a raw, emotional video pleading for change. Not anger, not politics, just a desperate appeal, so no other family had to experience what hers did. And here's the uncomfortable truth. This isn't rare. Across Canada, emergency rooms are under constant strain. Patients wait for hours. Some leave without even seeing a doctor. Others wait too long. This isn't about careless doctors or lazy nurses. Many are exhausted, understaffed, and doing the best they can in impossible conditions. The failure is structural and it's been building for years. When someone can die waiting for emergency care, the issue stops being theoretical. It becomes moral. How many warnings does the system get before we admit it's failing the people it's meant to protect?
Is it recorded? So Prashant Sri Kumar complained of acute chest pain at 12 o'clock noon today. This is Monday, December 22nd, and he was brought to Grey Nuns Hospital by 12:15, 12:20. He was sitting in the triage from 12:20 onward till about, I would say, 8:50 or till about 8:50 in the night. He was sitting in the triage complaining of constant chest pain. His BP constantly kept on rising with the last recorded blood pressure of 210. He was taken inside. He was only prescribed Tylenol during the entire waiting time that he was outside, and he was not given help. They said that chest pain is not considered acute problem. They do not suspect a cardiac arrest. When he came inside, he was asked to sit down. He got up for fraction of seconds and he collapsed. He fainted, and the nurse was heard saying that I do not feel a pulse. So basically, the hospital administration, the employees of Grey Nuns Hospital have basically killed my husband, Prashant Shri Kumar, by not providing him timely medical help. And the security was so rude that instead of addressing the cause, they said, ma'am, you are being very rude. So basically, it is okay for them to kill a human being and to tell the wife that you are being rude. Thank you. This is my statement, and I would want this to be taken to the court.
Canada has universal healthcare. So, how does this happen? The truth is complicated. Canada's healthcare system hasn't collapsed, but it's cracking where timing matters most. On paper, universal coverage works. Most Canadians eventually receive care. But in reality, access is increasingly delayed, and delays in healthcare aren't neutral. They can be dangerous. Across the country, patients wait 2 to 5 hours just to see a doctor in emergency rooms. In some provinces, it's even longer. Last year alone, around 500,000 people left emergency rooms without ever seeing a doctor or without ever being seen. Outside the ER, the problem deepens. The median wait from a family doctor referral to treatment is nearly 29 weeks, one of the longest wait times among developed countries. 1 in 5 Canadians ended up hospitalized while waiting for non-emergency care. These delays don't just frustrate people, they turn manageable conditions into emergencies and emergencies into tragedies. A major driver in workforce shortages. Canada needs tens of thousands of more nurses and thousands more doctors. Burnout is pushing experienced staff out faster than replacements can be trained. So no, the system isn't broken beyond repair. But when timely access fails, universal healthcare becomes a promise without protection.
They said to my father-in-law that if Prashant would have come even 2 hours earlier, we could have saved him.
They admitted that had he been seen prior, they could have saved him, or what was the exact wording?
Yeah. Yes, it was the exact wording, and Dr. Miles refused this to be recorded. But I don't know if somebody had actually recorded or not. Don't quote me on that, Lisa, at that point in time. But we wanted to, and he refused to say anything while he was being recorded.
So then, did he bring you in to see Prashant, and is that where you made the recording? Explain to me what happened next, right after he told you that Prashant had passed.
I said I want to see him, and they took me to the room straight away. And that's when, I started pumping his heart, and I thought maybe he'll still come back. But by that time, he was already gone. By that time, all his friends and everybody had come, and I just wanted to be with him. I felt his body. It was so cold, like he had left me by that time. And the Dr. Miles was telling my father-in-law that here is my car, do what you can. Like nothing will ever happen to me because I'm protected by my insurance and AHS's insurance. I can't believe he's gone. I just feel that, there are still days to his funeral, Lisa. I just feel that, oh my God, can he just come back to me?
Yeah.
I'm just hoping that the Wednesday never comes and he comes before that.
The death of Prashant isn't just a tragedy. It's a warning about where Canada's healthcare system is heading. The system was built for a different Canada, one that was younger, smaller, and less complex. Today, demand is rising fast. By 2040, the population over 65 is expected to double. Emergency rooms are absorbing the fallout. People who can't find family doctors. People waiting months for specialists. Gaps in mental health care. Everything eventually funnels into the ER. When emergency rooms become the front door for everything, they stop functioning as emergency spaces. That's when minutes turn into hours and hours turn into irreversible outcomes. There are solutions. Expanding the role of nurse practitioners, using AI-assisted triage, to identify high-risk patients faster, invested in community-led and indigenous-driven care models. But experts warn that without serious, sustained investment, these reforms won't scale fast enough, and tragedies like this will become more common, not less. Canada still has a choice. Treat this as an exception or recognize it as a signal. Because healthcare systems don't collapse overnight. They fail quietly, one waiting room at a time.